Hello, everyone. Welcome to Therapy Clips with Dr. O. I'm from the organization Human Service Consultants. Today, our topic will focus on antisocial personality disorder. I will give you a definition for this particular disorder. It is a pattern of disregard for and violation of the rights of others. It begins by the age of 15 years. Here are the criteria or symptoms for the disorder. The person will have a failure to conform to social norms with respect to lawful behaviors, as indicated by repeatedly performing acts that are grounds for arrest. Number two, this individual is deceitful and engage in repeated lying, using aliases, or conning others for personal profit or pleasure. Number three, the person is impulsive and fails to plan ahead. Number four, this individual is irritable, aggressive, and will engage in physical fights or assaults. Number five, the individual is reckless, disregard the safety of others or the safety of themselves. Number six, the person is consistently irresponsible, as indicated by repeated failures to sustain and keep consistent work behavior or honor financial obligations. Number seven, the individual lack remorse, as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another person. Now, let's move into some other symptoms that I didn't mention. So, in other words, the person with antisocial personality disorder repeatedly ignore right from wrong, tell lies to take advantage of others, not being sensitive or respectful of others, use charm or wit to manipulate others for personal gain, pleasure, or superiority, have problems with the law, including criminal behavior, becomes hostile, aggressive, violent, or threaten another person, feel no guilt about harming others, doing things with no regard for the safety of other people or for the safety of him or herself. This person is irresponsible and fail to fulfill work or financial responsibilities. So, now you may want to know, well, what caused this type of behavior? It can be caused by the genes that you're born with or someone is born with. And it can be especially neglectful and abusive to another individual. It can result in changes in the way that the brain function, or may be the result of how the brain has developed. Some of the risk factors is understanding that antisocial personality disorder is first diagnosed in childhood as conduct disorder. It could be a risk factor that because a person is born into a certain family of people with antisocial personality disorder or other type of mental disorders, they may also develop those disorders. The person may have experienced abuse or neglect in childhood or come from a violent family. And as a result, it leads to complications such as spouse abuse or child abuse or neglect, problems with alcohol or drugs, being in jail or prison, attempting suicide or trying to kill someone else, having other types of mental disorders such as depression or anxiety, having financial, educational, or social problems, and this individual may die early because of violence. So there's no way to prevent someone from having antisocial personality disorder, but there are treatment options available. And the treatment options are psychotherapy, and that is talk therapy, psychodynamic therapy, and that is therapy with things going on such as role play, and cognitive behavioral therapy. And once again, cognitive behavioral therapy is changing the way the person think in hopes that the behavior will change too. I'd like to thank you for taking time to listen to this presentation. I am hoping that if there's anyone who recognizes the symptoms within themselves and you're a part of my process and my group, you will open up and you will begin to have conversations with me to hopefully improve the quality of the way that you think so that your behavior can change and so that you can move forward into a more positive and productive lifestyle. Have a blessed day, everybody. Until we speak again, be safe, love yourself, but take the time to love someone else too. Take care.